Yes, being prepared can save lives. For one Valley man, it meant the difference between life and death. When he passed out at work, his co-workers knew what to do, and it was an AED that turned out to be a real heart saver.
Darrell Ball is glad he's back to work at the Fresno County Office of Education. He's spent the last 2 months recovering from a major heart attack, an attack that struck while he was only a few feet from his office door.
I came back into my office and still wasn't feeling good, and I had decided, that I was going to give my wife a call. And for some reason, that's kind of the last thing I remember is coming back in my office. And after that, I guess I kind of blacked out. All I remember is, the pain that I was having in my arm, heart, chest pains, that kind of thing.
On June 13th, Friday the 13th, Raj Sarah entered the men's room only to find his coworker passed out on the floor.
It was quite a shock when I opened the door and actually saw his face. It was obvious that it looked like there was no sign of life. His pupils were completely dilated, and his face was a shade of burgundy almost. It was really a pretty traumatic sight. I remember that we had defibrillators here in the building, and we had people that were trained in CPR. So I ran out to Kayla, who worked in our facilities department, and asked her if she knew CPR. She said she did.
With paramedics still minutes away, Kayla Wilson remembers rushing to find the automated external defibrillator located just down the hall.
I think we defibbed him twice, and then the ambulance or the paramedics came. They defibbed him, the fire department. So, he was shocked many times. So I didn't really think when they left that he was going to make it.
Thanks to their efforts, Darrell did survive and was rushed to Community Regional Medical Center. Dr. Celine Manternak was the attending physician in the emergency room when he arrived.
He was pretty groggy. His eyes were glazed over, but he was able to somewhat communicate with us. And, he was definitely very, very sick. There was no question that something bad was going on.
After assessing his condition, Dr. Manternak activated the hospital's cath lab team and alerted a cardiologist who stabilized the patient by placing 2 stents near his heart, which allowed blood to smoothly flow through his arteries. Dr. Manternak says from door to balloon, Darrell was stabilized in about 36 minutes, an amazing response time considering the national average is closer to 90 minutes. Darrell says he's both shocked and impressed by those impressive numbers at Community Regional.
A good story there because it was so fast. And I was, after I, of course, woke up and, have a recollection, I was very impressed with their service there, the way they got me in, did the surgery, stabilized me. And even when I was in the ICU, the nurses there were absolutely great. And they took care of me. I had absolutely the best care I felt, that I could get there. They did an amazing job there.
Darrell benefited from just one of the many heart-related programs offered through Community. In addition to offering automated external defibrillators through the Community Cardiac Response Project and a world-class cardiac catheterization lab at Community Regional, the Fresno Heart and Surgical Hospital has been named best in the Fresno region for overall cardiac services, all working toward one goal, saving lives.
This case shows that we are striving for excellence, and we had a great cardiology team on that day, but really the kudos go to the bystanders who saved him. They're the ones who really deserve all the applause and accolades.
Darrell says his employer used his incident to spark change by tripling the number of AEDs installed at the downtown office and training employees to use them.
I knew that they were here. I didn't really even know how many we had or the exact locations even, but I knew that they were here. But like I said, I never imagined that they would be here to help me, save my life. And that was kind of another surprise.
Fresno County School Superintendent Larry Powell says he's thankful the AEDs were in place during Darrell's incident and hopes this experience will help others make a life-saving decision to install them in other offices across the valley. In fact, MedWatch got word of another life saved with the help of an AED in early November. Way to go. To learn more about the Community Cardiac Response Project and its AED program, call 459-BEAT. And, of course, you can also log on to our website, medwatchtoday.com.